Hey guys, Dr. Yaker here. Today we're going to discuss what my thought process is to determine how many grafts you may need for your procedure. The first thing is to determine how much loss you have. Obviously, the larger the area of loss, the more hair transplants you may require. But we first need to look at the hair itself. I like to use a handheld microscope, or what's called a dermatoscope, to look at the hair in full and check the quality and the characteristic. So clearly someone who has fine straight hair will not have the same density or fullness with their result as someone who has thick and or curly hair. So it's always important to set realistic expectations based on the quality and the characteristic of someone's hair. When it comes to quality, what do I mean by that? Well, we see sometimes people who have very dried out, very straw-like hair, and so it's important to try to make sure that we can get their hair as healthy as possible. Other things to consider, again, will be the size of your loss. So for example, your loss may be centered to the front, but if your sides are quite low, I clearly have to go east-west before I can go north-south. So in order to cover all that area, it may actually require more hair. In addition, hairlines. Let's say you're losing your hair in the front, we have to design a specific hairline that makes sense to you. So hair numbers will differ based on shape and height of the hairline. Other important factors are just your baseline density. What do I mean by that? As a recap, density is defined as how many hairs you have in a given area. So to make you look dense is the same thing as saying to make you look full. Density does not mean thickness. That is a hair characteristic. So let's say you happen to have 90 hairs in a given square area, and that's your baseline density. In order for you to give the appearance of fullness, you need to actually have about 51% or more hairs there. So I need to what's called dense pack those areas if you have more density. Is it possible to dense pack and get 51% or more of your hair back in an open area with one session? It just depends on the person. So we again want to be very open and transparent to the patient that they may require a touch-up in the future to achieve a density of 51% or more. The last most important thing also to understand is that when there's a stark contrast between skin tone and hair tone, you're always going to look thinner than someone who has a similar tone to a similar hair color. And the reason is when you have that stark contrast, a lot of light can penetrate through. I have a lot of patients that come to see me thinking they're losing their hair simply because they have such dark hair with such light skin. So we also have to play that into the factors of how many grafts we need. As I said earlier, this is not a one-size-fits-all. We always recommend doing a little bit of research coming in, but it is always important to be evaluated by your hair transplant physician to know how many grafts you need and to be able to set realistic expectations. For more information on hair transplantation or any of the other non-surgical treatments that we offer, please log on to yakermd.com or check out more of our videos. Thanks.